I'm now delighted to hand back to Fiona Benson. Just to remind you about Fiona's poems. Fiona has written a series of poems inspired by women's experiences of fertility, birth control and gynaecological care. And you are going to hear them now alongside a new audio piece created collaboratively with the radio producer Maya Bosworth. And as Fiona mentioned earlier, one of her poems is a powerful, raw account of a pregnant woman forced to give up her baby for adoption. And it also contains an account of rape. So just to draw your attention to this poem, which is going to be read at the end, and if you would like to step away for that poem, please feel free to do so, and you may wish to sit near the back. And if you've been affected by those issues, you can contact Rape Crisis or Families for Children. I'm now delighted to hand over to Fiona, who's going to read her wonderful, wonderful poems. Let's give her a big round of applause.
So I was speaking about Dr. Jane earlier, Dr. Jane Richards, who trained in the 1950s and practiced as a GP in the area. And with Maya Bosworth, the radio producer, we conducted some interviews with her. And Maya has put together a little listening session for you all using extracts from the interviews so that you can encounter Dr. Jane Richards. This is a little tribute to her that Oliver's going to play for us now. Thanks.
This is a typical box that a midwife or a GP obstetrician would have, keeping all their midwifery instruments in one place. So the instrument at the top, and underneath there would be a sterilising container here. And you'd be able to put the forceps or anything else that you want, any instruments, into this and boil it up on whatever sort of form of heating the house would have, and boil it up so that it was sterile, and it would be sterilised at each time. It's a bit like a fish kettle, because there you are, put your fish or your forceps. And that would live in underneath there. And here would be all sorts of test tubes and things with different liquids in it. This is a very superior one, having those. Mine didn't have that. Mine just had the fish kettle. I guess a lovely description of it. My name is Jane Richards. I'm from here, from a village of Whitstone outside Exeter, and I was born in 1933. Inside that you would have the various forceps, which you would have ready for you to put in, and the other one to go on top and clip together so that you could pull the baby's head out comfortably. Starting at the lowest sort, these are called Wrigley's, because I suppose Wrigley must be the person who first used them. And we used to be a little bit rude about these on the whole. These we used to say were for the mums who were too posh to push. We'd get called out in the middle of the night. And so you just pulled on a pair of trousers and a jersey and went. And then I'd had to put on scrubs. Well, scrubs in those days for women were just a kind of dress, you see, to about there. And they then asked me, could I help lift the patient from the trolley onto the operating theatre. I had to kind of climb across, you see, and carry out. I realised I'd only got on nighty, sort of up here somewhere, nothing else underneath, because I hadn't put a pair of pants on. I'd had a pair of trousers on when I came out. You didn't mind getting up in the night. You went back to bed thinking, done, something achieved. And you went to sleep. This is that. Wait a minute, let me get them the right way on. Yes, that's the first one. And there's the second. When you come to using them, they've got scalloped edges to the handle. And if you've got small hands, cold ones or not cold ones, like me, it's jolly difficult being sure that you've got a safe grip.
I mean, we spoke about this quite a lot, that Dr. Jane has got very small hands. And all these tools that you were using were designed by men and for
Like
men.
yes. Just look at that.
Yeah.
I mean, it's very difficult with my very small hands and very small fingers too. There's always rather a problem because no gloves are quite as short. So there's always a bit of glove beyond my finger. And I've always had great worry about when sewing up or doing anything, further up there. You're doing it on feel. You have to be very careful that you don't sew your glove into the vagina. Do you remember delivering a baby at home, which turned out to be one of twins? Very, very prem. And so we had to get it out. So we wrapped it. I had to send father downstairs to find the foil, the cookery foil, to wind the baby up in. So a nappy and then cookery foil. So we did, and then I had to take it in the car. And luckily, the mother's brother was there, staying with them by chance. So I made this poor young boy sit in the side, cuddling the baby while I drove like the flappers. The other comic piece of equipment is this one, which is a self-retaining speculum.
Yes, you told me about that.
Yes, now this
it's not very comic, is it?
Well,
it's
it's horrifying, yes. And if you pick it out, you can see it's really quite heavy. But this was the idea: was you sort of hooked it into the vagina.
Yes.
For mending up, for doing prolapses and things, and for going back into there, and the sheer weight of that, which is lead, you just hold it down.
So it's.
See what I mean? So it will self-retain itself. So you didn't need somebody else to be holding a speculum, because that would do it, and then you would work up there, and you'd have to probably put a light in. But
was it painful for the woman?
I should think so.
Yeah.
That hanging, I should think it's most uncomfortable.
Yeah.
There were some really rather nasty things. People didn't think about women as people. They were definitely items. I feel that, but thank goodness I never had to use one of those. I don't know what the date of that would have been, but all I can say is it's nasty in this book. Oh, Rosie. She had not married. She had cohabited with her cousin. She had 9 pregnancies in all, which was really rather worrying. And I do remember her coming, and not really first. Not really believing her, not wanting to give her the pill. She came within about a fortnight of the delivery. She'd been delivered, I suppose, in Mowbray. Well, I don't know if she had been delivered. Yes, she was in Mowbray, that one. Well, Dr. Jones, will you give me the pill? I said, but Rosie, it's a bit soon. Your body doesn't need it yet. It needs to settle down and sort things out. I can't wait that long, she said. He'll poke me for another one. So that I was cautious, I must admit. I wasn't terribly simple. But then, when she said that, I thought, oh my golly, help. What do we do? And her elder daughter, she was pregnant at 15. Now, what else would you like me to show you?
What's over this side?
Over there, that's a fetal stethoscope of an old one, Laennec. And that we would have used that in general practice because, monitoring the mum, to listening to the baby's heart, because you put that on the mum's tongue and then listen to it.
It's rather beautiful.
It is.
Like
It is
wooden
ivory.
recorder.
Ivory. It is rather lovely. But you press it down like that on the mum's tongue and listen to the baby's heart. And you listen. You put that on. It does magnify sound,
Oh yes, it does.
doesn't it?
Yeah.
It's got something to do with the shape and size of it.
Yeah,
It does,
It's got a slender wooden wand that opens into a bell shape, which is hollow, and then there's a
A flat ivory
flat ivory earpiece.
earpiece that you
And
press into your ear.
amplifies the sound.
There are some that one of my I'm very fond of, I have to admit. is a girl who works for Marks and Spencer's on the bakery counter. And Ruth, I delivered her daughter, and her daughter's working for Marks as well. And she works with another woman down at Marks on the bakery counter, whom I've got to know. And they all greet me because I was Ruth's doctor. And it's an ongoing thing that's important to them. And last night, we had a quiz with the social club out at Whitstone. And I was talking to somebody who'd come, I didn't know, and I said, "Oh, where'd you come from?" She said, "Exeter, but I was your patient." She said, I knew who you were directly I came in the door. No, I haven't, it's 30 years since I've seen her. But, there's that sort of ongoing connection. And one in Marks, an older lady, one day, she says, "Dr. Dent, it's nice to see you." She says, "You delivered my son and he's 50. And I thought, I don't know if he remembers. And I felt like saying, at the time I was delivering your son, I was actually concentrating on your fanny, not your face. And at 50, if he was as much as that, I certainly wouldn't remember. But you see, nonetheless, patients have connections, and it is an event. Obstetrics is an event in their life cycle.
So that was Dr. Jane Richards, and I feel like we owe so much to that generation of women who, trained as doctors when it wasn't normal and gave their lives to being GPs and just forging a way ahead for all of us. I'm going to read, first of all, the poems that were inspired by the Devon and Exeter Medical Heritage Trust collection, of which Dr. Jane Richards is a trustee. And this starts with an account of the herbal remedies that women have turned to terminate unwanted pregnancies in the past. Woman's herbal. We drank bitter water, bloodwort and juniper, blue cohosh, cedar, madder, which stains to the bone, tansy, black hellebore, prostitutes, fern, pennyroyal, castor oil, possets we swilled before the ensoulment, when the fetus was still a rumour, unlooked for, an omen. A late period we brought on with corsets and poison, screaming hot baths, needles and hooks. A stitch we unpicked before it quickened, became real. And these next two are about tools that are in the collection that are still used in certain forms in modern day evacuations of the womb. Dilator. Dilators arrayed like Allen keys in a fabric wrap. Each straight metal rod increasing in girth to be inserted one by one into the locked door of the cervix to coax it open. Now we use laminaria, sea tangle pressed in slim wicks to serve as osmotic dilators, a slow swelling spindle in the cervical mouth that ekes out an opening, lets the embryo down. Curette. A thin metal stylus with a hooped blade, spoon-shaped to debride. It looks like a wand for blowing bubbles with soap at the kitchen sink. Curette. From the French to scoop, to scrape, derived from the verb to clean or cleanse, and denoting in its own way healing, linked as it is to the Latinate cure. And this is a response to a photograph that Dr. Jane showed me of the British Medical Association, back in the day. Photograph, the British Medical Association at Tintagel circa 1850. Physicians in stovepipe hats posed against a church. No women, of course. But again and again, one of them stepped up, put all his mind and attention to the bodies of women and the dangerous labour of birth, did his utmost to assist, tried to make the tool that would fit. Wrigley, Anderson, Eliot, Keeland all sought the right traction, the perfect swerve and grip. I think in the process of writing these poems about the tools, I did come to realise that they were all an act of care. No matter how scary they looked, they'd all been designed with the aim of either saving the labouring woman's life or of the child's. So they may look scary, but they come from a good place. Forceps. Invented as early as the 1630s. The Chamberlain family's device, taken in hugger-mugger to the birthing chambers, sealed in a lined box. All attendants made to leave the room, the desperate woman blindfolded, and only then the implement retrieved, like a magician's trick, and used to grip the fetal head, to draw it through the birth canal and pull it free with hooks. Secret for almost 100 years, though the midwives dropped hints at instruments of iron, and a sly rhyme did the rounds concerning Hugh Chamberlain's pale face and narrow inspection. So women in Chamberlain's purview were saved, but the others, poor women, out-of-towners, rural women, died. In 1723, Jan Palfijn presented his parallel blades to the Academy for the Public Good, paddled tongs to grasp the baby's head and pull it down, nicknamed gently Palfijn's hands. Cranioclast, invented by Dr. James Simpson in the 1800s to save the mother's life from the threat of a retained fetus. Long-shanked, narrow blades the professor pulls across to show me that were inserted into the vagina and used to macerate the baby's head. Not pretty, he says. Christ. There's a woman who writes she could not give birth to sons. Their skulls got stuck in her canal. She had not the strength to push them out. Small lives she felt quickening, busy sometimes as a barrel of eels, delivered still, with their skulls sodden and mulched. Forgive us our methods. It was the only way the mother could be saved. The fetal head is the main obstructive force. She was exhausted, and the baby had been dead for hours. Understand, we did what we could to honour life. We did what we could, and the mother survived. This is the famous self-retaining speculum, which you heard about in the Dr. Jane interview, which had this massive lead ball on it to pull you open. But actually, as I came to research this was also designed to help. So this is the poem, Self-Retaining Speculum. This broad steel shoehorn to prise open the vagina, its long metal sluice for blood and effluvia, and its lead-weighted ball chocked against the buttocks on the table's edge, heavy cold. Even this was meant well, leaving the surgeon's hands free to sew up fistulas in the anterior vaginal wall, or to perform a hysterectomy on a tumoured womb. Yes, even this was made to heal. Argo. Words too are handling tools. We say dilate when we mean force apart, curette when we mean scrape, forceps when we mean blacksmith's tongues with which to grasp a thing that burns, contusion when we mean bruise, vertex when we mean the top of the infant's head, infarction when we mean crushed, blood-stuffed, devitalized when we mean dead, macerate when we mean cut to shreds. This is how we bear the child's immaculate hands and the mother's weeping. So I got very used to the word vagina. I used to like that word. Now I'm just vagina this, vagina that. So this is the next poem is a long poem. I'm not going to say much about it, apart from that it's an account of forced adoption. And this was in collaboration with Julia. Child mother. Harbour waif. Barely schooled. Barely fed. Part servant, part stray. Docked in the south of France, your yacht bunk rocks, and bad things happen in it. Just 15, that giddy drive back down the coast with a skipper from another boat, the yachts tilting in the harbour down below, all their little lights swerving, blurring, returning from a party where everyone drank champagne like it was lemonade. And you were young and thirsty from the sun, so you tipped back your throat and did the same. Then what? Waking sour and greasy in your bunk, dry smear of blood, a flashback of hands you did not want, the car pulled into the verge, not the first. By the time you were sure it's too late to abort, your mother laces you up in a corset. No, you correct me, nothing so tender. She hands you a corset and you lace yourself in. Swim up into its sheath with your hands in the air, hook it down the front, then swivel it round, tighten the laces so you will be straightened, your state concealed. The baby will be taken, no question. Meanwhile, you must work. When you are 7 months gone and can no longer care for your sister, you're sent by yourself to Eastbourne with 2 sets of clothes and your granny's coat cut down, brown boucle, which you wear in your room to keep warm. It's the coldest winter you've ever known, the sea itself frozen, a fluting and rick-rack of ice on the stones, and your feet slipping numb in canvas shoes. The Methodist family you stay with pray at meals, holding hands, take you to church and are kind, but you want to hide. You stay in your room or head to the centrally heated library and read all day about vitamins and how they feed the body. You read about nourishment, unnourished girl. You read about love like a faraway tale. You're in the system now, a checkup each week. One day your blood pressure soars and you're admitted without warning to the ward. Your house mother fetches your things and you slide between stiff sheets, girl in a ward full of husbands and wives who mutter and tut, whose eyes skid over you. You keep your head down and knit, white 2-ply wool, matinee jackets, bootees, tiny clothes for a doll. You're good at this. Beneath the gaze of the nurses who treat you like dirt, you knit and knit with wool as soft as falling snow, and you freeze yourself off from the ward, very inward, very cold, lonely child. Your stomach hurts. You tell the nurse. Was it something you ate? Can you please have an aspirin? She tells you you'll feel better soon. She is lying. You are wheeled into the labour ward, a long corridor of beds screened off with thin and breezy curtains. You're scared. An unseen woman is roaring, an unseen woman is crying. It's like being stalled in an abattoir. You feel their fear. The woman in the next booth is given gas and air. You hear her suck it in. No one asks if you need anything. You can smell blood and something else, something sweet and faintly curdled that turns your stomach and makes your nostrils flare. You are left alone in your cubicle, metal rail, tiled floor. Left alone to the pain that racks you, girl in a room of fully grown women, bellowing like bulls. On your hands and knees, the baby's head crowning and out-of-body wailing. Finally, the midwife comes to attend as you bear down and strain. You are so grateful for her voice, you'll do anything she says. Breathe, 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 push. The doctor stitches you up, and you are left again, your stomach deflating slowly, like a helium balloon, empty and alone. The baby is taken to another ward as soon as the cord is cut, returned sometime later, wrapped in a flannelette blanket. You refuse to hold or feed it, but they make you take it and nurse it with a bottle, give you big green pills to dry the milk in your breasts, which are enraged. They make you take her and feed her again and again until one day she does not come, and you ask, and they say, offhand, "Oh, she's gone." You cannot remember how she looked, that 7-pound baby. Not how it felt to hold her loose, warm weight, nor her head against your cheek, whether it was downy or bare, nor if she clutched your finger, nor her scent, milk sweet. You knew she wasn't yours to keep. And you, who had known so little of love and had so much love to give, were afraid that if you started now, you wouldn't know how to stop. So you made yourself numb, the way a hemorrhaging womb is packed in ice when the placenta is torn away and the body weeps, and the midwives wait for the surgeon. This is how we staunch the bleeding. This is how we save the woman. Your mother comes to pick you up in a cab 2 weeks after the birth. You walk out to join her in the car. That night, in the double bed you're made to share, she asks you why on earth you're crying. You get yourself out. Go down to a farm in Devon with horses. You get yourself out. You have always worked hard. You make yourself a life with animals and birdsong. When you meet your man, you go to the clinic for contraception and they are disapproving. You are not married yet. And when you ask them for the coil, they say they only fit them in women who've already given birth. And you say, well, in fact, I've had a child, and their intake of breath makes you feel ashamed and enraged and defiant. You'll have children when you're damn well good and ready. You work as a veterinary nurse, marriage, 2 daughters, but something is missing. You rarely speak of it. The 3rd child's hand not tugging at your leg. a fear that she is somewhere hurting. There are days that are dark. There are days when you just can't. When your daughters eat ice cream, you turn to wipe your third child's face, and she is not there. With your second-born, something was wrong. For the longest time, you couldn't bond, couldn't properly love until you were sure she'd stay, the way the old ones misnamed their children to stop them being taken so the fairies wouldn't know or see them, like that daughter they took in the confusing wood of your childhood, where your rapist was a wolf and your stepfather was also a wolf. At the vet's where you work, you are shaking. You are putting on your coat. You are going to meet your eldest daughter for the first time since her birth. Your colleague says he never thought you were the type to give up a child, and you freeze. At the Families for Children Centre, you step into a room that is thronged with support workers, but all you see is her. There is no mistaking your child. She resembles you like a sister, your beloved, long-lost daughter, as if nature meant you to find her, meant you to know each other. All you can do is stare. Thank you.